Hi there, I'm Dr. Ken Mueller. I'm coming to you today from the Sports Medicine Rehabilitation Clinic at Bloor and Dundas in Toronto. I want to talk to you about a common condition that presents in clinical practice all the time, and something really simple that you can do for yourself which will save you a lot of pain and dysfunction and possibly even help you be on the healing track faster. When people do arrive presenting with low back pain, it's very clear right away when they present with something called an antalgic gait. This is when you change the way you move as a result of pain. So you might be hunched over, you might be putting a hand on your low back, you might be limping a little bit or shifted to one side. This will continue when you go to sit down into a chair or get up from the chair. As chiropractors, we're gathering information this whole time, and oftentimes I can give a positive educational intervention before we even continue with the assessment. Right at that point, when I see you having trouble getting in and out of a chair, I know that's a place where I can make a difference. So let's talk about that right now. When someone's in a fair bit of low back pain, it often changes the way they stand and sit. It's not because of the pain that they're not able to, but they think they need to move around that pain, and when they do that, they actually might be making their situation worse. We have really strong quads, we have strong glutes, but unfortunately when we're feeling low back pain, we tend to grab onto the arms of the chair, lean forwards, and actually flex the low back when we're getting up. This puts more pressure on the ligaments and the muscles in the low back, which have to engage now to support you. Now you're thinking, but I'm using my arms. Well, you are, but you're also using your back. So instead of that, I don't want your hands in the arms of the chair. I want you to shift your chest forwards. I want you to pre-contract your tummy like someone's going to sucker punch you. Pre-contract, strong tummy, shift your body forwards, feel the pressure in the balls and the heels of your feet, and stand. Just like you're doing a squat in the gym, you're going to hinge at the hips. So you're going to lead with the butt, flex from the low back or extend from the low back, and flex from the hips. So we are doing what we call a spine sparing motion. We're not flexing from the back, we're flexing instead at the hips. So we flex, put the bottom down, then you can shift back into the chair if you want at that point. But as you're getting down and up, I want you to do as though you would a squat in the gym. Hinge at the hip. There's another exercise that I often teach in conjunction with this, which can also help you master that movement because it's something you really can't cheat when you try. So let's do that one as well. It's called the wall-facing squat. To prepare for the wall-facing squat, you need a clear area of wall where you can touch your toes to the edge of the wall, right at the floorboards, and your fingertips will touch the wall right around shoulder height. We're going to make sure that we're hinging from the hips, so you have to back up the bottom, and you're not allowed to touch your nose or your knees to the wall. That's a no-no. So if you follow those basic instructions, you will learn to hinge from the hip because there's no other way to do it. When you get to a certain point, you're going to feel that your tail wants to tuck between your legs, like your bottom wants to tuck under. That's the end of the line for you that day, and you don't want to push it past that. You often will feel a little bit of pressure in the low back, and that's okay. You're not going to do yourself new harm if you're moving in control, but you do want to make sure your nose and your knees stay off the wall. And if you're feeling a little unstable or you don't have someone to help, you can always put a chair behind you to catch you just in case you fall. So you can place a chair behind me for just in case, and I want to make sure that my toes are touching the wall and my fingertips are touching the wall. I'm going to slowly lower down, hinging from the hips. Nose and knees are not allowed to touch. At a certain point my tail will want to tuck, and that's the end of the line for me. I shouldn't go past that. I should push back up again. So I slowly slide down, and then up I come. As I repeat this motion, some of you will feel like you want to fall backwards, so you want to have a chair nearby just in case. Oftentimes you're going to want to cheat by pushing your face forwards because you're used to using that back to flex to get you up and down. But once you automate this motion a few times, when you next go to sit down, tummy will go tight. You'll lower yourself using a squat technique, back yourself into the chair, and you'll be on your way to better movement, and you'll probably need fewer treatments because you won't irritate yourself quite as often, and you'll feel a lot more independent a lot sooner. I hope these little tips can help, especially when you're in a lot of pain. Please do come for professional help as well, but if anything that you learn here is getting you back on the road a little bit faster, I'm happy to help. Hope you have a great day. Bye for now.